Everyone, this is Brian from How3, and I'm excited to show you a little bit update on our progress so far. And this is with the CMS Blue Button integration to get claims and insurance information. So I'm gonna go through it pretty quickly. There's a lot of things happening in the background, but I'll try to be very brief and then talk more about that in some sort of post or something like that. So the first thing I'm gonna do is I'm gonna onboard a new patient. I'm gonna click continue here, and I'm actually gonna create a patient for myself and someone else that I'm managing. So this is going to be myself, quickly onboard, add our sample patient that we've been using. Okay, and then I'm going to say I'm the child, and that is it for onboarding. So I didn't enter any other information, and we moved the connection tab from down here to be here. So there's much more of a context scenario. So I can be managing on the top left here, some care for myself, or in this case for my dad. And in this case, I may want to do things like look at his meds, his insurance, or connect to grab data that's external. So that's what I'm going to do in this demo. I'm going to connect to CMS's Blue Button account to grab all that information. In this demo, we're mainly going to grab the insurance information. So this is a sandbox user. Everything here is obviously fake data. And so this is the Medicare OAuth process. I'm connecting to it with Smart on Fire. It takes a second. It grabs all that data. It brings it into our Firestore and compares to our operational database to see if it currently exists. And in this case, we didn't enter information about the insurance. So this is all brand new data. And we found 4 different types of coverage from Medicare Part A, B, C, and D for this particular user. And so what we recommend in this case, because it's new coverage, we're going to go ahead and click continue so we can bring it into How3. So that's going to do some things in the background, one of which I'll talk about later that I'm pretty excited for. But then for the user, it will simply just populate all of that in your insurance. So it's nice and handy in here. Now, to be more realistic, your insurance changes every year, sometimes every month. And so you may have a need to connect again. So in this case, we've implemented a matching process. So in this process where I might connect again, I think we will probably automate this in the future, but just for demo purposes, let's say we're doing it manually, we're going to connect again to the same patient and grab the same information. And so when we go through this reconciliation process, which again will be automated in the future, this would actually look something like this. This already exists, there's no differences, and we have very specific checks of what are those semantic differences. Things like last updated dates or like version IDs, those don't change. We check for things like periods. Is there a new insurance or not for a particular month? Are they due eligible or not? All these different things are the semantic things we care about, and only then will it flag that we don't have an operational database, and it will flag in yellow and say new version, new information is available from Medicare, and then it would actually default to this, and then you can continue on. The other thing I want to show you is in this dashboard, if I go back to insurance, that the Medicare, this Center for Medicare and Medicaid Services is actually very unique. It's actually an enrichment. So part of this process, we've also implemented our own enrichment module, because when we get data from CMS, it's actually like a very bare bones free text string that says it is Medicare from CMS. And one of the first enrichments we implemented is we will take that and enrich it with the actual CMS organization with all the rich semantic attributes involved. And so what's nice too is we stamp that. So there's a nice audit trail when external healthcare entities look at our data and use our data, they will see that stamped on there. So let me go into this place, and this is the operational database. Here's the 4 different insurances that came in, and what I want to show you here is that we did this process twice. So the very first one was this post, and then this put was the second one, which is the update. And what's really cool here is if you look closely at the very bottom, we apply an enrichment when a patient onboards and it's a new insurance, and we add this where we switch their free text string, that's CMS, to an actual organization that we manually curate and seed, and we keep up to date and has lots of good information about CMS. In the future, what would be nice is, because CMS and health insurance is such a complicated landscape for caregivers, when individuals are interested in learning more about it in that insurance tab. Let's say, for example, in here, they're like, what exactly is CMS? Maybe they want to learn more about it. It will be a clickable link that can teach them more about CMS and how to navigate insurance. Hopefully this is interesting. There's a lot of technical stuff that we implement in the background, and now we're just working on making this into prod because we got a lot of linting and just little things that we just gotta get ready for prod. But it's about 95% of the way there. Let me know if you have any questions. I'm pretty excited to share this with everyone.